Hypoplastic left heart syndrome, or HLHS, is a congenital heart disease that affects normal blood flow through the heart. The condition can be found in about 2 to 3 of 10,000 live births per year. To start talking about this condition, let's take a look at the blood flow and structures in a normal heart. In a normal heart, deoxygenated blood enters the heart from the structures on the right side of the heart. When the blood reaches the right ventricle, it is then sent to the lungs to become oxygenated. The blood then returns to the heart by the left atrium, then through the mitral valve into the left ventricle, and then through the aorta and out to the rest of the body to supply oxygenated blood. In a heart with HLHS, the left-sided structures are affected. As you can see here in this model, a heart with HLHS has a much smaller left ventricle than a normal heart, as well as an absent or non-functioning mitral valve. The cause of these defects are often a result of hypoplasia in the aortic arch and valve, which is a narrowing of the aortic arch and valve, causing a reduction in blood flow to the body. This causes less blood flow to the left side structures of the heart, which results in an underdeveloped or smaller than normal left ventricle. This is hypoplastic left heart syndrome. In some cases, the effects of this stenosis could possibly be reversed while the child is still in the womb. The procedure would be a fetal aortic valvuloplasty, which was first performed in the U.S. in the early 2000s. A team of experts are used in the procedure. These include an anesthesiology team, a physician interventionalist and interventional team, a physician imager and imaging team, nurses, radiology techs, and other support staff help monitor the mother and baby and support the many teams involved. An epidural is performed on the mother to aid with any discomfort during the procedure. Medication is injected into the fetus's leg so they remain calm and still during the procedure. Once pain medication has been administered, the doctor will use ultrasound as guidance during the procedure. A catheter is inserted into the mother's abdomen through the uterus and into the fetus's heart. Once the catheter is inserted and in the correct position, a wire is then placed into the catheter. A balloon catheter is advanced over the wire and will be used to stretch and dilate the aortic valve. The wire is advanced across the aortic valve and the balloon is then gently inflated. Doctors will then check to make sure that adequate blood flow is flowing through the aortic valve. Once this is done, the wire and needle are both removed. If this procedure is successful and improved blood flow is achieved, it will allow the left ventricle and left-sided structures to keep growing during pregnancy. The baby can have a functioning and normal-sized left ventricle at birth, which will eliminate the need for potentially numerous heart surgeries after birth.